हाय वेलकम बैक टू डेंटल बॉयज यूट्यूब चैनल। आज हम लोग डिस्कस करने वाले हैं कुछ रूट कैनाल रिलेटेड कॉम्प्लिकेशंस।
So generally, people feel कि root canal procedure is a very simple procedure, and anybody and everybody can do it. So today we'll share with you few cases and few complications which can be as severe as what we discussed in our last video, which was the related to surgery and extraction. So even if you don't do a root canal treatment properly, or you don't know the proper technique of doing a proper root canal treatment, then what and all complications can happen. In today's video we are going to highlight it for you. So today's case was shared again on was shared on social media, and it was sent to me by my colleague. And so here we put up the case for you, what has actually happened. So, Dr. Kunal, when you look at the X-ray, what do you actually see? What has happened according to you?
Okay, so mandibular canal mein I can see there has been extrusion of the material which has been mentioned here, that is metapex.
Okay, so Metapex is basically a material that we use in, first of all, mostly in children, because that is where it is indicated for. I don't know what it is doing in an case of an adult tooth.
Okay.
Usually, it is used for open apex cases to close the apex in children, or mostly it is used as a filling in root canal, which is done in deciduous or primary teeth which are present in children, which are going to fall off because this material resorbs on its own.
Yes,
So it disappears after some time. So usually in children we use such materials after the root canal, which is not permanently present, because it can hamper the eruption of the permanent tooth. So usually this material which has been mentioned here is used in children. We usually don't use it in adults. So what exactly has happened is, this is an injectable material. We'll show you. Whenever it comes in a syringe, and it is filled through via injection into the root canal. So what happens is, if you are not cautious while you are injecting this into the canal, and you apply excessive pressure, this material goes beyond the apex of the root, or the tip of the root. It is extruded beyond that, and what happens is, like we mentioned in the last video, there are many important vital anatomical structures, like the nerve which supplies the lip and the tongue and this area of each side underneath the molars, like in this tooth. So what has happened is that this material has been pushed beyond the tip of the root due to excessive pressure, and that has now gone very close to that nerve, or in that nerve space. Because of that, what has happened is, the patient has the nerve sometimes gets compressed, and the patient has started to feel complete numbness in the lip, chin, and adjacent areas. So this is a very easily avoidable complication. The only thing you have to know is how much pressure you have to apply while injecting this material. Basically, you have to know what materials you're working with, what is the density of the material, how much pressure has to be exerted, until what level it has to be filled, and what material has to be used. Like, I feel this is a wrong material choice which has been used. Usually, we use calcium hydroxide, which is water based, in interim root canal sittings, so that that is antibacterial, and it is water based, and it doesn't set. So we use non-setting one, so it can easily be washed away. But this material, it doesn't. You cannot wash it very easily because of the nature of how it is. It is calcium hydroxide mixed with iodoform, which is usually used in children as an obturation material. So it is supposed to resolve on its own. You cannot easily wash it away. So now that has caused this, like, we'll mark it where it has gone, where is the vital now over there, and that is now causing numbness for the patient, which is usually, which we see in a very complicated extraction after surgery. The patient has transient numbness. Now, how long this numbness will be there, or how, whether it will be permanent or whether it will be transient, that is very difficult to say. Now, coming to the solution to this problem that has been caused, it's very complex, because you have to remove all the material which has been used to fill the root canal properly, and you keep on injecting saline into the canal, hoping that it goes away. And if it doesn't go, you have to otherwise call an oral surgeon and open up this area, visualize the nerve, and physically remove the material, which is very traumatic for the patient. And the last resort is referring the patient to a neurosurgeon because it's a nerve, and they have to see what damage has happened, how much functional the nerve is, and accordingly decide. So it can be permanent damage, it can be temporary. It depends on the luck, how bad it is going to get. But this is a very avoidable complication. Like we keep saying that these things can be easily avoided. I cannot even say that it happens because it doesn't happen.
Yes.
It is very easily avoidable, and it becomes, like I said, a simple procedure. Because of all this, becomes a very complicated procedure for the patient, for the doctor. It's a headache to get a resolution for this, and it all depends again on how lucky the doctor and the patient is that this gets easily resolved. Also, action has to be taken swiftly. You cannot wait and watch what is going to happen because this material is known to cause necrosis of the tissues. So if it causes a long-term necrosis in that area, it can be a very big problem. So action has to be swift. You cannot wait and watch approach cannot be used here. So again, it's a very problematic process caused by a inadvertent extrusion of this material, which is very avoidable, like we say again and again. So anyway, coming back to the topic at hand, so the next complication that we want to talk about is the extrusion of a material known as sodium hypochlorite, which is the primary disinfectant that we use in a root canal treatment. That is also a very caustic material. That's why we always advise to use that material under what is known as a rubber dam. We'll show you videos what is a rubber dam, and the concentration in which it is used uh, also can cause the tissue in the adjacent areas to completely burn off if it comes in contact.
Yes.
That is why protection of the tooth and the adjacent tissues in which that material is being used is very mandatory, and it is mandated by the law. But 95% people in our country do not use this protection that has to be used for the patient, owing to cost factors, which is very wrong, which we want to highlight through this video. We'll be showing you a video, which will show you what is the difference of how it is applied and how we use it.
Yes.
So when this material, so there is a particular type of needle, a special needle, which has to be used with this when you're injecting it into the root canal. And like I said, 95% do not. You protect the adjacent areas, so they are not going to spend on that special needle which is used to inject that into the canal. And what happens is if you don't use it and it goes through the like how this material has gone through the root tip into the vital areas, if that material goes, that causes havoc for the patient. It is very disruptive, very destructive. We will be showing you cases.
We'll be sharing some
photographs of
cases.
how it looks when it happens, and how dangerous it is when this goes in larger quantities. Little bit here and there is okay. It happens with everybody.
Yes.
But when it goes beyond a certain quantity, that is owing to the lack of using proper equipment to actually administer this while doing a root canal treatment. That is the reason why this extrusion happens, and again, inadvertent pressure while injecting.
Yes.
So again, it is all comes all down to the technique of doing the treatment. These are all very avoidable complications, and it all depends on the technique of doing the treatment. Because people feel कि root canal कोई भी कर सकता है, ऐसा नहीं है. Conscious effort has to be taken, और consciously वो ये सब वापरेंगे while doing a root canal treatment just to protect the patient from any harm. And this is long-term severe disfiguring harm. So that is one of the. Now coming back to one more complication which we have highlighted in one of our shorts is the separation of the instrument which is used to do a root canal, which can happen with anybody. So but also this also can be avoided and be taken care of if it happens. So now this is a complication where if it happens with anybody, you have to know how to manage it properly. You cannot just send the patient away with that in the mouth. You can either remove it, like we will show you in the video how we remove it. We use the microscope and special tools to remove these broken instruments, or you have to bypass it and clean everything around it. And it is a manageable complication. But what we have seen in many cases is that it is just left. Patient is not informed about it, and that becomes a severe problem later on because the tissues get infected underneath it, which are not removed due to the instrument blocking that area, and that causes infection and problems. We will put up cases, and then it becomes again severe complication. So again, this, even if this is not a very avoidable complication in some cases, the management is very important. In the first two instances, it becomes a little unmanageable because it's a liquid and it flows anywhere. This is a very manageable complication, but only the operator has to have the equipment and the technique to manage it, or refer it to a specialist to remove it. Like we remove a lot of files underneath the microscope, but that again is a costly procedure, and generally people like to keep the bills of the patient low, and that is why they don't want to refer them and get and wait for it to get severe and complicated, and then it becomes again a massive complication. So another few complications that we would like to share. I will be putting up the X-rays. In these, you will see that the anatomy is somewhere and the filling has been done somewhere else. So I would not say this is a complication. This is a blunder and negligence on the part of the operator, where आपका रूट कैनाल किधर और है और वो मटेरियल किधर और ही जा रहा है और वो क्या हो रहा है, maybe quacks are doing it, or I don't know who is doing this type of things, but we see this very often in large quantities. Fortunately, the patient doesn't feel the symptoms till it gets very severe, and so they feel everything is okay. But ऐसा नहीं है. This ideal root canal should look like this, and in comparison we will show you how these are being done. So basically, to put it in a nutshell, it's like there is a confine within which you have to put your instruments and your filling material. It's a very thin and confined space. It's a micro space, and when you do your instrumentation and you are not and you're overzealously doing it, and you don't know where you are doing it, you tend to cause holes in the tooth, and then you are not realize what has happened, and you put the filling material and it goes in all directions. So that is also a very common complication that we see. It's not a complication, actually, common errors that we see, that is not actually you can't call it a complication because you are not supposed to do this. It is, but it is being done at a very sizable number. That is why we are highlighting it. So again, coming back to the gist of making all these videos is that patients are generally not aware about what are the things that can go wrong if the treatment is not rendered in a proper fashion. If you do not use proper equipment, if you do not have proper knowledge, they feel that रूट कैनाल सबको सेम आता है, भले ही वो प्रैक्टिशनर 40 साल से कर रहा है या 5 साल से कर रहा है, ऐसा नहीं है. With experience and with the advancement in equipments that you have within your clinic, you can do much better than what anybody else can accomplish. So there is a difference. There is a difference, highly gradient difference in how a root canal can be performed by a skilled practitioner and a comparatively unskilled or inexperienced practitioner. So just the cost is not very factor to justify it. Any doctor who is charging well is using good materials, good equipment, has great knowledge, and has done a lot of hard work, and has learned the skill over time, and basically has learned what not to do. That is very important. In all these cases, you will see that it's very important to know what not to use, what material not to use, what treatment that you're doing, where you should not be going, than what has to be done. And that is the reason why we see in our practice 80 to 90% cases are re-root canal treatments, where we are correcting the root canals that have been done before. And it is sad to see it is not what we want to do, because always doing retreatment is a very tough job. Once something has been washed up, getting it back to normal, it never usually happens properly. It happens in majority cases, you can say 50, but that 50-60%, but 40% cases inadvertently go for extractions and implant replacements, which become again a costly procedure. So what happens is, if you don't take the right call at the right period of time when it has to be done, at that when you try to save a few thousands, that may cost you lakhs in the future.
Correct.
So that is the basic gist that we want to summarize this video and summarize all our videos. That treatment rendered is not equivalent to the cost charged. There is a big difference. Like root canal treatments should actually be as costly as an implant, because you're saving a natural tooth. But people are not evolved up to that level where they feel that they can charge that much, because they're doing a service to the patient by saving a natural tooth, which will definitely give much better results. Though I'm an implantologist, and that is my primary profession, I always feel wherever possible we should save our natural teeth and avoid such mishaps while doing so.